Good afternoon, everyone. So welcome to our laboratory, and this is the second session. So before we start, to make the session smooth and flow, I have some housekeeping rules to announce to you all. The first is when you join our Zoom meeting here, please rename yourselves, use the full name and also the country, because our program assistant will check our attendance. And next is please mute when you are not speaking to avoid the interrupt sound when the speaker is speaking. And next, we will use the chat box. You can raise any question and post any question, comments in the chat. Please use the chat box. And then if you have some in the question and answer session, you can raise your hand to raise your questions. And before we start, I would like to invite my supervisor, Ms. Chintana Siwongsa, to give us some remarks before the session begins. Please invite.
Thank you very much, Tanyaporn, and welcomes also colleagues and friends to the second session of the third phase. I think we met on the first session, which was in the 5th of August, 5th of August, and we learned something on that day. So today is going to be the second group, I would say, second group. So here is our plan of the agenda. So we also encourage everyone to moderate your slide on your own, and just to keep up with your pace, Today, once again, is going to be our great honor to have the excellent moderator. So 2 of them today, but they informed me that today is going to be led by Dr. Usma, and then it's going to be backed up by Damri Naidu from CRO, right? So I'd like to give the floor to Dr. Usma to lead the discussion and stimulate the exchange of tips, exchange of experience when they just enter to the third phase of working as a group. Dr. Usma, so floor now is yours. And as I said, 45 minutes for each group, and our team will be supporting you from the Department of Medical Science. Thank you very much for your time. Dr. Usma, please.
Thank you very much, Chintana. Just a voice check and a video check. Can you see me and can you hear me?
Perfectly fine, ma'am. So we see your face and we heard you very well. Yeah, thank you.
Okay, thank you very much. So I would like to welcome everybody to today's meeting, and we have a little more time than the first session that we had day before yesterday, which gives the opportunity for our trainees and participants from the Training of Trainers, Training of Mentors event that you attended in May to be able to share and put into practice one more time after independent group work to this panel. We understand that all of you are respective experts in your field and have either challenged yourself. It would be great for us to actually understand your experience of working with this content. So we would like to hear from you first, and then come back with some comments as relevant. So yes, you will be talking about the content, but as explained to you, the idea of these sessions is to understand from your feedback how you prepared as a facilitator to be ready for delivery to a cohort that you will be running in your own country. I'm going to stop now, and I see that the first presentation is going to be on biosecurity from the team in Cambodia, I believe. I hand over to the team in Cambodia to introduce themselves, and over to you.
Yeah, good afternoon. My name is Ratana Chia. I'm from Cambodia and I'm from National Animal Health and Production Research Institute, Cambodia. Nice to meet you all. Panya?
Yes, good afternoon, everyone. My name is Panya. Currently, I'm working at the National Institute of Public Health in Cambodia. Nice to meet all of you.
Dr. Rajnan, please unmute and please share your screen to present. Thank you.
Yes, thank you. We have only 2 persons from our team today, since another colleague have not joined as he have a lot of duty. So can I share the screen? But I cannot find somewhere to share the screen. Okay, I found now. So to make sure, do you see my screen?
Yes.
Yeah, thank you. So myself, Ratana, and my team, Panya, will do the presentation on biosecurity. So I'm from animal health and Panya is from human health. So we have adapted the presentation, the model to our country context, even though we still keep the techniques from the modules. So after completing this module, the participant will be able to define the laboratory biosecurity, difference between biosecurity and biosafety, and we will give the country context how we use our biosafety system in my lab and the Panya lab. So the module will talk about biosecurity principle, policy, and procedure in our lab. So let me start by introduce something about related to the biosecurity. So biological agent, in this context, we refer to the pathogenic microbe, for example, bacteria, virus, like that. And environment, we also concern on the chemical and biological toxin or biotoxin. And security, we refer to storage, loss, legal, or custody, contamination, prevention for biosecurity. So biological threat, whether it's natural or accident or man-made, can be kill millions of people, cost of millions of dollars, and also critical political and economic instability. So we also heard some recent years that people use biological as a terrorist, something like that, or we only suffer from COVID. That is one of the, I'm not sure if the accident that can cause our loss and a lot of things. And it also concern when we travel abroad, we can carry our pathogen and spread to other colleagues. So biosecurity is referred to institutional personal security measure designed to prevent loss, theft, misuse, diversion, or unintentional release of microorganisms, other biological material, and research-related information. So this limit access of facility, research material, and information. So biosecurity elements will also involve some of the biosafety. So biosafety is part of biosecurity. And biosecurity is also part of biosafety. So on the left-hand side, you can see Panya is working on the lab. So he also concerned on biosafety. At the same time, he also concerned on biosecurity, so that biosecurity is not to, he work in the biosafety cabinet so that the pathogen may not spread to other colleagues or outside. So on the right-hand side is a refrigerator that store the pathogen with lock and inventory, so people can access only those who authorize. So what conflict between biosafety and biosecurity? We also have, I have this picture from my lab that I can talk on the picture because the text is about picture. So when we see the biosafety, we have the sign so that this area is biosafety level 2. So no entry if without permission. And there is person who in charge of this. So if you want to enter, you need to inform us. So there is my phone number and my contact over there. So you will see that down in the bottom, there is a key locks with the code. So not everybody can enter, only those who have the right to enter. So on the right-hand side of the room, there is a lab. On the left-hand side is the office. So who should have the biosecurity program? So any institute working on biological that can harm to human, animal, plant, environment should have the biosecurity plan. So any facility that have biological material that have value assets is considered that should have the biosecurity program. So example from my lab, we have biobanking. Instead of using a refrigerator, we also have the pathogen access control that we store the tube, only the code, and the computer system have the detail of pathogen. So nobody can know, this only the code that prevent from the misuse of the pathogen, and also easy for us to aware and understand and know what is pathogen we are going to work on or keep of them in our system in event logs. And also there is the red circle that I circle here is about authorized personnel and key log. So this is inside our lab, so we can use the key log. And also it's our former system, so we still use key log. And here is the biosafety manual in my lab. There are also biosafety and biosecurity in the same document. So I can example here, like I mentioned earlier, that biosafety and biosecurity is same. So in the middle of the slide, there is a content of the document that safety handling of biological material, waste management, and emergency procedure, training, cleaning. So we also mention part of the biosafety, especially biosecurity, also in that. So on the right hand side, there is one SOP of us that we work on staff induction. So you see there is a security, so people should know about security before they come into the lab or handling the biological material. So why do we need the biosecurity program? So to protect our employee and co-worker, to protect our biological material and information for unintentional use or accidental, and institutional reputation. So in my lab, we also declare what biological agent that we have to the United Nations through the I forgot the full name, but it's like Ministry of Defense in our country, networking with the biological weapons agency that we report every year that what pathogen we have and store in our lab and what capacity that we have to protect from spread to the outside. So I would like to brief a bit about valuable of biological material. It is not about harmful or dangerous, but it also scientifically history. We can use it in the future for many purposes. So we need to store it and secure them, like not to damage or stole or unintentional use by other. And yeah, on the right hand side, we need to document and folder, or what we have here is a biobanking in the computer server that we store all of our information. So biosecurity program here we have in our context that regulatory, administration, and physical security and practice. So I will go one by one with a summarize. So we have national security, especially we have from biological agent. In the Ministry of Health that Panya working, there is a clear declaration on the spread of pathogen from my animal health sector. We have focused mainly on the animal disease spread and also animal disease that can spread to human. Also, it's reflect to the current situation in our country that we need and what we can do at the moment. So administrative, we have so far like biobanking, personal training, authorized personnel, documentation that we have, and SOP on disposal and discharge of our pathogen after testing or after that we don't want it again. So I would like to mention it again. This from the lesson that one is store it completely correct, one is access control, one is another logs from the outside of the lab, and authorized personnel or well-trained personnel, and also limitation of access to the laboratory area. So here is the hierarchy of control, that is elimination, substitution, engineering control, administration, procedure and practice, and personal practice equipment. So I pick up only 3 from this hierarchy to what we have in our contact, and the personal protective equipment is we integrate with the procedure and practice. So access control, beside the biobanking, we have the saver room that only those who authorized can access the saver room. So this my left hand, even I use the fingerprint or the code that can access that. And the IT of our institute work on that. But those who can access, and not only the IT, but also the lab personnel who responsible for this server room. So I move to the activity that what we can summarize and can get interaction from all of you. So I would like to get a volunteer from these 3 questions. So which activity that consider as biosecurity and biosafety? You may have additional comment or you have question. So please, may I get a volunteer, please? Excuse me, are you with me?
So, Rohtana, if I understand correctly, you're asking for a volunteer among the other participants? All participants?
Yes,
Okay.
please.
So,
It's for the first
Rohtana
question.
is asking all participants to respond to question number 1 as potential trainees.
So from the lesson, what do you think biosecurity and biosafety activity, what we have in our slide?
Okay, Ratna, I wanna volunteer for your activity.
Yes, thank you. Please.
Yeah, for for the biosafety, is look like the procedure or method that we prevent the person from the contact with the pathogen or biohazard material. That is like as you said, the hierarchy of the prevention, like engineering, administration, or the low protective is a PPE. That is the meaning of the biosafety. Like when you want to work with the biohazard material, you need to work in the biosafety cabinet or in the biosafety level laboratory, something like that. And for the
Yeah.
biosecurity, it seems like how to prevent the valuable biological material from the unauthorized person. That is like a limit or control the access for the people to the biological material. Mhm.
Yeah, thank you. Thank you very much. Would like to add a bit that I missed. So for example, we wear PPE. So this is one of the biosafety, but also one of the biosecurity. We prevent the unintentional spread of the biological agent from our activity to ourselves. For example, I wear the N95 mask, so I protect myself from the pathogen. So it's one of the activity to prevent the unintentional spread of the pathogen to myself. Yeah, thank you. But you are all right. Yeah. Okay, so any of you have comment or idea, please?
Oh, I see one comment from the chat box. Dr. Johanna also said about the biosecurity is
Yeah, please. Panya, you may respond.
Yeah. Excuse me, Ratana, I have one question.
Yes, please.
In Cambodia, did you have the Pathogen and Animal Toxin Act to control the people to work with the pathogen or animal toxin?
Thank you. At the moment, we are not yet have it as an X, but we have as the procedure in our lab. For example, my institute, we have procedure to prevent as a biosecurity procedure that integrated with the biosafety and biosecurity manual. And for the human health, may I would like to Panya to share the idea, please.
for human health related to my laboratory. we have we are going to construct the biobank in our institute in order to store the sample with the highly pathogen, and we plan uh to have the transportation from the provincial lab that we consider that we will consider which pathogen that is the prioritized pathogen. So now we have the prioritized pathogen like the avian influenza H5N1, mpox, EV71, and COVID-19 and melioidosis.
And
So
melioidosis.
yes, this is the plan that we're gonna do in the pandemic fund. So the provincial or the regional lab in Cambodia, they can send the sample to us to an IPA, and we will store the sample in our bank, and in our bank we will to make sure with the biosecurity also, but we will plan to do it. Yes, thank you.
Thank you. I would like to add a bit. We from Human Health and Animal Health, and also Ministry of Defense and other who have the biological lab. We have the microbiology lab network. So we have do something so far, but still not yet become the biological or toxin X. For example, we have the work together on classification of pathogen. We work on who have the biological agent and store what purposes, and they need to have at least internal regulation not to spread the pathogen to outside. That is what we have at the moment. Yep, thank you. So any of us have a comment or question, please?
Rohtana, this is Dr. Usma. I just want to suggest if you could continue to the end of your presentation, and then maybe we can take all the questions at one time.
Yeah, thank you.
Thank you.
So I would like to continue. Actually, this is activity. If we are together in person, I would like to ask you to separate two groups, or at least write many of your thoughts per person and stick note to us so that we can respond to you. And all we have discussed. When you finish post sticker, we will write the note and summarize into the flip chart. So that is what the activity that we will use when we do the actual training. Yeah, thank you. So I move to the summaries. So biosecurity is the protection of microbiological agent from loss, theft, diversion, or unintentional or intentional misuse. So biosafety following the safe working practice. Biosecurity practice that help keep working and material safe and secure. So any facility work with biological material could cause harm to human, animal, plant, and environment. So they should have biosecurity program. Or if possible, like we should have biological and biotoxin X, like Chan mentioned earlier. So this is another time for question or comment, please. So here is our reference. Yeah, thank you very much. That is end of my presentation.
Thank you very much, Dr. Rotana and Dr. Panha. Very well done. We are still within your time and have a few minutes for comments from my co-facilitator, as well as from questions from other participant countries. I'm going to hand over to my co-facilitator, Dr. Zamari, for her comments on your presentation, and we'll round it up after. Over to you, Zamari.
Thanks, Usma. Can you hear me?
Yes.
Great. Thanks, Rotana and Panya, for the presentation. Very well done. And it was clear to see where you have adapted to the national materials. There is one question I had, though, as you were going through the presentation. I was wondering, within your group, you were, I think, 2 or 3 people that had worked on this presentation together. Can you give us a sense of how you got together as a group, how you decided which pictures to add, which policies to add, and whether you had any challenges of deciding, across the sectors, what to adapt for the national context, and how you came to a decision collectively within your group. I think that would be a good learning for the group. But I also wanted to congratulate you on the pictures that you selected to demonstrate some of the context of the materials. Thank you.
Yes,
Thank
I
you.
would like to answer to the question of the Damari. So how you ask us how our group working. So because now Dr. Ratana he is at the Sweden, but I am in
And
Cambodia, but we still work closely by the Telegram, so that when for example I start to Dr. Ratana start to do the slide presentation, and then he suggests us to review it again if we have something to change, or we can add the picture, we can discuss each other, and then we combine the common idea in order to make this slide happen. Yes.
thank you. Regarding to another question, for example, policy that we have.
Maybe Panha, you can mute, please.
Yeah, please mute. So policy that we have, we share together. And I mentioned the policy that we have in my institute, and Panya also mentioned the policy in his institute, like the picture I saw here. And sometimes we have challenges on what picture to put and what information need to cut off from the whole competency. So we pick up this and summarize for those that is important in our sector, human and animal sector in my country. So that is how we adapt. So we do and we send together for exchange idea, and also get the idea from that's a comment from our mentor, Dr. Darapya.
Great,
Thank
thank
you.
you.
Yeah.
So I found the hand raising from our colleagues from Malaysia, please.
One second. Damari, do you have any further questions?
Yes.
No, it's okay from my end. Thanks, Usma.
So I can hand over to our colleague from NPHL Malaysia. I see your hand up, please. Over to you.
Yeah. Good evening. I'm Salva here from RPHL Malaysia. Great job done by the team. I think it's very well explained. Only thing I like to, I have one suggestion here, because this is through my observation and experience working in the lab for almost 20 over years. Many laboratory technical people, they doesn't understand, or they does not how to differentiate between biosafety and biosecurity. I think it's good if you all in the first slide put a definition: what is biosafety, what is biosecurity, when the biosafety comes, and when the biosecurity comes. I think this is very important, because through my experience. Thank you.
Thank you. Yes, that is also the above challenge of us that we need to cut all of the slide, most of the slide from the like 100 of slide to like 10. So before we have 20 minutes, so now we have 45 minutes. So I accept your comments. Here we should add the biosafety here or about here to let the audience know what is biosecurity, what is biosafety, and then we can jump to other element of the biosecurity. Thank you.
Thank you, Rotana. I saw another hand up before Rita, but I cannot seem to find the...
Dr. Sawang, please.
Yeah.
Please go ahead.
Okay. I just have to share some of experience in my institute. I also act as a institutional biological committee to look after the person who work with the biological material. In Thailand, we also have the Pathogen and Animal Toxin Act. Every people who want to work with the pathogen or animal toxin, you need to follow the act as a national level. And in my country, in my institute, we also have the pathogen bank. And in the pathogen bank, we need to use the biosecurity. We need to limit the people or who can access to the pathogen bank to handle or to manage with our pathogen that we store. And every procedure that we work with the biological material or animal toxin, we need to follow the Pathogen and Animal Toxin Act, or even if we want to store it or handle any biological material, we need to follow and we need to write out the document for give the permission from the committee. That is some of activities about the biosecurity in our institution.
We
Do you have
cannot
any
hear you.
response, please? Any comments from the team?
We cannot hear you anymore. You finished your comment, right? So let me respond to about comments. Yeah, actually we should have an X, and I appreciate on the experience that I learned from GLLP that Thailand have the X, but since we have not yet have many lab for animal health, so only my institute that have play role for highly pathogenic, even bacteria or virus. So we have only internal biosecurity plan. And other like university, they only play with the low pathogenics or non-pathogenics for practice only. So for animal health side, we can do only this at the moment. And the person who can work only few people, not few, like about 10 or 15 people. So all of them need to have the train on the handling pathogen or other thing that I mentioned in the here. And one thing that they need to be trained, and only some of us can store or pick, and we have the biosecurity measure like we have in our slide. May I request Panya to share some situation in the Ministry of Health, please?
I don't have any more comment. I just said already at the beginning.
Yeah.
So,
thank you.
That's all for me.
Thank you. I'm gonna ask. I don't see any other. Only Rita's hand up. So Rita, over to you.
Please.
Thank you. Thank you, Uzma. So I have two questions about the process of adapting this module. The first one is regarding one of the objectives that is new for these modules. So I understood GWADED has an objective to differentiate between biosafety and biosecurity. And this is actually not originally phrased in the module. So I found it very interesting. And I would like to ask you if you think this should be added to the module, to the generic version of the module. Also, we have a module that covers biosafety, that is the previous module. So this is covered in principle prior to C1, to C2. So it's, and here we have a couple of slides that compare the two topics and the two concepts that were very well addressed in my perspective. So this is my first question. The second question is about the tools we have available to help instructors to adapt the modules. I would like to know if you found the pre-modified document helpful while you were adapting and discussing adaptation for the module you picked. Over.
Thank you. May I get the first question again, please?
So the first question was just to brief it up. Rita, can I summarize, because I think we are running out of time for the first group. The first question is, there is a module which precedes this one, which is on biosafety, and you have taken put an objective specifically differentiating between biosafety and biosecurity in this particular module as an objective. Is that your assumption that this needs to be one of the objectives, or you're just doing it for the purpose of this presentation? Rita, is that what you were asking? Yeah? No.
Yes. Yeah. This is the objective that we do for this presentation. So what we learn from the is that we summarize and practice to be the trainer. So we pick up only the main point, but actually the whole thing should be biosafety one module, biosecurity one module. But here we mention a bit about biosafety to avoid the participant misunderstanding, like about question, to avoid the misunderstanding between these two terms. Regarding the second question, that is tool we use, we face some challenges to what is the most important thing to provide to the audience. If we have a lot of time, we can put all the things that is important for biosecurity. Even we have video, group discussion or practice. Yeah. Thank you. I hope this answer to your question. Thank you.
I want to add for the first question that Rita asked about the related competency that we don't put in the slide. Yes, we don't put it in the slide because at the beginning they said we need to make the slide no more than 10, so that's why we decide to cut some slides. That's why we cannot see it in here yet. Yeah, thank you.
Yeah, one more thing, I just add something before the presentation about few more slides. Thank you. Hope this understandable. Yeah.
Thank you very much.
Thank you.
Yes.
Rita, do you have any follow-up questions, or that's okay?
That's okay. Thank you, Uzma.
All right. So just for the information of the team from Cambodia, and I'll come back with my 2-minute comments after this. Any feedback that you would like to provide on your adaptation process and challenges, you still have a feedback survey that will be sent out at the end of it. Please feel free to specify which module you presented and what particular challenges you might have had. That is one of the questions that we actually had in the email that was sent out to you. So what I want to just come back with is complimenting you and congratulating you on doing a good concise snapshot of this module, because we understand that the module has a lot more content. And of course, for the purpose of this this session, that was not the intent that you present all the modular content. So you've done a pretty good job of highlighting one objective and sticking to that, and then summarizing it at the end. There's a beginning, there's a middle, and there's an end, which is great. What I also would like to appreciate, like the people who came before me, is the fact that both of you did a lot of discussion and working around to highlight examples from both sectors. That's also a comment that my colleague Virginie has put in the chat, because she's not able to speak and contribute, but this is very commendable. It indicates that when you're talking to a diverse audience, there is something for everybody in that audience, which is the intent of the program. It also seems that you were putting yourself in the place of a participant when you were putting pictures and scenarios and documentation that speaks to your Cambodian colleagues, because then we can identify with all of that, which is another great point. And I think that's when we are providing this feedback, it's also for the countries that will be presenting next time, and also for the countries that have presented before. The adaptation exercise is there as a test for you to see how you can do it independently and how you can do it as a group, more of what you did in Thailand. I really appreciate the question, the activity planning, and how you actually put all the participants in this session as your participants and just ask them to contribute. And I can imagine that the response from your participants is going to be the same. Nobody will speak up. You will have to draw them out. You might have to give them a few more prompts. So as facilitators, it's good to put that into practice. And the comments and the suggestion from our Malaysian colleague, especially if you decide to split these modules between more than one day, some of those messages could be reinforced. Because there's a lot of content in each of these modules, and how much you decide to work with on the participants is up to you to decide. I think Rita's question on how the adaptation facilitator guide was helpful is going to be very helpful for us to understand. If you can provide feedback on specific sections that could be clearer and more explicit, to help facilitators such as yourself and others who come in after. I think you have highlighted the adaptation slides very well. You have given good captions to photos. Continue to do that as a practice, not just for the session, but for the entire course of your materials as you develop them for Cambodia. And I think your duration was great. Your approach was great. We had pertinent questions. We have 5 minutes left. If there are any further questions from participants, questions from presenters, things that you think we need to clarify further, you can ask right now, or put them in the chat, or put them in the feedback. But we have the floor open for any comments on this particular module or in general. Okay. Hearing nothing, silence is not gold always. I appreciate the fact that Dr. Panha and Dr. Rotana, the work that you have done, and I hope you continue to do that for the rest of it. I think this module was very well chosen as well. And just put in as many country and region specific examples. One last parting shot before we move on to Philippines is that when you're doing your modular delivery, and imagine yourself as the module, you're talking to people who are experts in the field. So there might be people who understand biosafety very well, and there might be people who actually don't. So you're speaking to a diverse audience with a diverse level of understanding on that particular module. Try to address the audience as a whole and try to include the participants who actually know more about the subject as contributors. So that'll make your job easier. You'll not be the one talking all the time. So that would be a general tip, and try to include all sectors. I think we are doing great on time today. And if there are no further comments, I would like to invite the team from Philippines, Ms. Mariag, Dr. Jennifer Mercado, and Mr. Richard Ramones for their presentation on quality management system and how they adapted it and feedback. Over to you, Team Philippines.
Thank you.
Dr. Jennifer, could you show you on screen? Yes.
Yes.
Thank you.
Thank you. Good afternoon, good evening, good morning to everyone who's here right now. I'm Dr. Jennifer C. Duduco Mercado, a pathologist from the National Reference Laboratory, East Avenue Medical Center. Together with me are two of my colleagues who will be introducing themselves. Net.
Hello. Good morning, good evening, good afternoon. I'm Lenita Marayan from the Department of Health, Philippines. Thank you.
Richard.
Good evening to everyone. So I'm Richard Ramones from the Philippines as well. Good evening.
So our group, the Philippines, chose the topic of quality management system. We believe that it's a crucial concept that is important not only in the laboratory and healthcare services, but we believe that it includes almost all the industries. So I just placed here a disclaimer that the core slides are from the presentation from the GLLP. While we may have some additions or modifications, we cannot claim ownership of the original slide content. The images used in this presentation are with permission or properly credited. So for a start, we would like to ask expectations. Just like what we have here, this is our Filipino dessert, which is really good, halo-halo. So for the participants, we would like to ask, what are your expectations with the lecture of quality management? Is it as full as this dessert, or there are still some reservations? So probably I'll just ask one participant, what is the expectations for this lecture? I believe one of our colleague from Papua New Guinea, Ernest, was my group mate back in Thailand. Or anybody from the group?
Hello, Dr. Jennifer.
Hi, Jennifer. Hello.
Yes. Our expectation, especially my expectation, is to learn from this module. Like we are trying to establish the QMS in our country, so we really want to have that more information in this presentation on how are we going to go and deal with this QMS in the country. Thank you.
Thank you, Jennifer. So I'd just like to present to you the module objectives, that after completing this module, we would be able to explain the importance of a quality management system, describe the laboratory path, list and understand the quality essentials, and describe the organizational element for quality management system. Though these objectives are there, we might not be able to meet all these objectives, as we are limited by the slides and the presentation that we have chosen. So these are the related laboratory leadership competencies from 3.1, then there is the 5.1, and then 5.6. So the following are the agenda for this module. What is quality? The quality management system, the 12 quality assessment, the planning as a tool for organizing quality management. And of course, after this module, we will have the key takeaways or to wrap up this module. So in the actual presentation of this module, we would want to use a Mentimeter for to gain what would the other participants think of what is quality. And we think that quality is very important in a lot of things. So probably I won't be asking Jennifer anymore, but probably another participant. What for you is quality? So do we have our colleagues from Thailand? I think one of our colleagues who is also a pathologist is here with us, Dr. Sawang. May I ask, what for you is quality?
Sorry, I'm driving.
Oh, I'm sorry, Dr. Sawang. But from the other participants, if the word quality is brought up, what do you think is quality?
I can try. Quality is something of excellence or a high standard or level of doing something. Thank you.
Yes, definitely. Quality for us is of excellence. It's error-free. And sometimes we think of quality as essential. It is essential for ensuring accurate, reliable results, just like in the laboratory or in our healthcare services. So in this module, we added a slide. This is courtesy of NET, wherein there is the analogy between restaurant and the laboratory. What is quality? For easier understanding, like if we eat in a restaurant, what do we think are the essential elements in that restaurant for us to say that it has quality? And this is compared to the laboratory equivalent and the quality perspective. An example will be the restaurant element would have the chef and the kitchen staff. In the laboratory, what is the equivalent of this personnel? It would be the laboratory technicians and analysts, as well as the doctors or the head of the laboratory. And what is the quality perspective of having this personnel? That they be properly trained, they are competent, and they are motivated personnel. So in this slide, we added compared the laboratory with that of a restaurant and what would be the quality perspective. Another example here would be the food delivery time, or when will that dish come out from the kitchen and be served to you. The laboratory equivalent for that would be the turnaround time for the result to come out after being tested, and the quality perspective is the timely service that is part of the quality. There are other restaurant elements and laboratory equivalent, and that of the quality perspective. This is another slide wherein we combined two slides from the original module. And it states here that achieving a 99% level of quality means accepting a 1% error rate. We had difficulty on what to use as an image. In the module, there was this airplane that crashed, and it it was the 1% error rate, we were thinking of how to change it or how to use it in the Philippine setting. But that is one challenge. We have not come up with an image to show that there is that 1% error rate. Though we discussed that a 1% rate means that it is the concept of an acceptable quality level. However, that 1% error rate could also mean mortality or morbidity. An example of which is in the water system here in the Philippines. We have a law that states that the drinking water must be examined for microbiological and chemistry. And if there is that 1% error rate, just like in the microbiology, that would mean that in water testing, one contaminated sample that was misread as a safe water could mean an outbreak of E. coli, which could lead to morbidity and mortality for a community. This is one slide that has been a challenge to us on what to use for that 1% error rate. So we just combined the picture and the wordings for this slide. This is from the module that states what is quality in the laboratory. So we used a picture from one of the NRLs, which is RITM, showing that a quality in the laboratory would mean that the product, which is the product of a laboratory, is the result. And that result must be accurate, it must be precise, it must be timely, it must be reliable, and it must have a fit for purpose. This is also one slide from the original module wherein it tackles accuracy, precision, and bias. But in the original module, there was just the description of accuracy, precision, and bias. It would be good to show pictures of what is accuracy. When we say the closeness of the measurement of the true value, it would be nice to show a picture so it would be easier to understand, as well as that of precision and that of a bias. So this is a picture that shows that it is accurate. What do we mean by precise? And it is biased. Precise, that is unbiased, which is accurate. And what is the picture of an inaccurate and that of a biased picture? So it will be easier to understand and easier to remember. We included the consequences of a laboratory only involving the patient or the client, but it would also involve the staff who perform the tests, because that would mean there will be a repeat. It could also mean a decrease in the confidence level of that person who did the test, as well as it could also mean that there is a decrease or there is additional cost on the part not only of the client, but also of the laboratory or the healthcare facility. Quality control and quality assurance are oftentimes used interchangeably. So we would want to emphasize that quality control is not the same as quality assurance. Both have different meanings. Quality control is more for the samples. It is investigation. It is making sure that the tests would not come out with errors. While quality assurance is systematic, to produce reliable and reproducible data. Both are important in the aspect of quality management system. Quality control and quality assurance are under the quality management system and should not be used interchangeably. So this is another picture wherein the quality assurance and quality control are both compared. So when we talk about identification of defects, then that would be quality control, because an analyst or someone who is meticulous was able to identify that there is an error and that that test should be stopped to prevent any erroneous result. While quality assurance is the prevention, before the error occurs, there would be a policy about the results that would be error-free. Quality assurance is proactive. It is systemic. And under the quality assurance, the external quality assurances or programs would be under, while in the quality control, it is reactive and it is a product-based approach. So we also, in this slide, we described and combined in this slide what quality management system is. It is the organizational structure, responsibilities, policies, processes, resources, direct control, and improving an organization with regards to quality in a systemic and process-oriented manner. So the plate here shows that there is the quality management system, that is the bigger plate, and under this bigger plate are the quality assurance and the quality control. So this is a laboratory workflow. It tells us the complexity. Sometimes we use the terms pre-analytic or pre-examination or pre-testing. Those are all synonymous with one another. So there is the pre-examination, the examination or the analytical process, and then the post-analytical or post-examination. And what are the things that are expected to be occurring in each phase? All laboratory must have a workflow. So it would be easier for us to understand or to look at the process if there would be errors. So when we talk of the path of workflow, it tells us of the entire process of managing a sample. There is the beginning, there is the middle, and then there is the end. And these processes are all interconnected with one another. Part of the quality management system is the quality system essentials. And for the quality system essentials, our group has an activity. It is an exercise wherein we would ask the participants to group themselves into two. One group would be having pictures, and the other group would be having the words. And they would need to match the pictures with that of the words. What are these pictures? These are the 12 quality essentials. And once they've matched together, let's say for manpower, we would ask them what the picture means and why is it important in a quality management system. So let's look at the pictures. So these are the 12 essentials of quality management system. So for example, they have a picture of the organization. So we would ask them, what why is an organization important? We know that it is vital to have that organizational structure for the manpower to understand what would be the roles and responsibilities, who are they answerable to, and who they talk to in case there are problems or in case they have suggestions for the management. So there are 12 essentials of quality management system. These are the following: organization, personnel, equipment, purchasing and inventory, process control, information management, documents and records, occurrence management. Management would mean if there are a client's feedback or they have complaints, how do we address these complaints or these feedbacks? Assessment, process improvement, customer service, facilities, and safety. So, in summary, a laboratory presents a complex operation, and all functions and all aspects must function properly to achieve quality. In a laboratory, the product of the laboratory is the result, and that result must be precise, it must be accurate, because that result would help the clinicians or our clients with how they treat a patient, how do they address a problem. The implementation of the quality management system is part of our job. It is not an additional duty, and everyone in a laboratory must understand what quality management system. It does not end with the analysts, but everyone in the laboratory, even our laboratory aides. Everyone should be in the same place, and we should be able to understand that what we want in the laboratory is a reliable result, and of course for the services that we need to give. Because if we have reliable results, if we have accurate results, it's not only the results that we are looking at, it's also the confidence of each personnel doing that testing, and it would also motivate everyone in the laboratory. Quality management also is applicable not only for the medical laboratory, but I think almost all industry needs or must use quality management. It needs to be implemented. It needs to be evaluated and improved. It is a dynamic process. It is a continuous process. We do not stop when we have an excellent feedback from the client. It must be maintained and it must be cascaded down to the end. Ultimately, all quality management system elements must be addressed. So for questions, if there are questions. So at the end of our presentation, we would again ask our participants for the expectations. Were we able to answer or address their expectations, just like the halo we have, or the expectation was just like a glass of crushed ice? So it would also help us improve in our delivery and in the presentation that we would have. So these are the references. And thank you. Maraming salamat.
Thank you very much, Dr. Jennifer. That was a very inspiring presentation, great examples. I'm going to save my comments for the last. Maybe we can first ask if anybody in the audience has any questions or comments regarding the presentation by the Team Philippines. If not, I don't see any hands up, and I look to the Secretariat if I miss anyone. I would hand over to my co-facilitator, Dr. Rita has her hand up. Yeah, Rita.
Yes, I do, but I don't know if you want to give the floor to Damari first, that's fine too.
It's okay. You can just go ahead, ask your question, and then
Okay.
we'll ask Damari.
Thank you. Yeah, so I wanted to start by congratulating the group. I really appreciate your presentation, and specifically that you kept the competency slide at the beginning. It's a new slide that was added to the version 2 of the materials, and we found it very interesting and important. So thank you for keeping it. I have a couple of questions about the process of adapting this module. So how long did it take for you to go through the content and then adapting? If you could give us an estimate of how long did it take to you to adapt it? And I don't know if you had the chance to look at the pre and post tests to this module. Do you have any suggestion? Did you find that the questions are appropriate? And I would also like to know your thoughts on the One Health topic. Do you think this was well covered in this module? We are currently working on improving this set of modules, so all your inputs and such will be very helpful for us at this point. Thank you very much. It's all from my side.
Okay. Thank you, Rita. For the module, we found it very interesting. There are a lot of lectures when it comes to quality management, but the modules, it was everything that you need in a module when it comes to quality management has been emphasized. We weren't able to show the entire module because it had so many slides. It was quite difficult to be which slide should we hide because everything was important, and even the 12 quality essentials, um, sometimes these are not tackled, but these are the aspects that must be that must have more emphasis on. So it would be easier for a participant to understand. About the length of time, the three of us come from different agencies. So it was also a challenge to sit down to talk. So we relied on whenever we have meetings together to have a short time to discuss on how are we going or what are we going to discuss for GLLP, what would be important to us. And just like what I've said, we believe that it's a crucial concept and that is important. And in the laboratory, it is a priority, and implementing quality principle is essential for ensuring accurate, reliable results. I think I would also give the floor to my other colleagues on what on their takeaway from the question that you've asked. Net.
Yeah, yes, I agree with Dr. Chen that we had some difficulty when we have the consensus on this or agreement on what topic to present. However, through Viber, through Messenger, we were able to, and through Google using the Google Sheet, we're able to share our opinion, our what slides or what slides to present. With a question on the One Health approach, actually, the Philippines, when we had this National Lab Strategic Plan, we one of the thematic area is the quality management system. So most of the activities will be asked the other department, the Department of Agriculture, regarding the implementation or even the policy making with regards to quality management system.
Richard?
Yeah. Hello. For me, with everything that has been mentioned by my colleagues, I just like to add with regards to the One Health in adaptation of the module. I think the quality system essentials and the whole quality management system in general is all the same and is adaptable towards One Health approach. And the major difficulty is that for me on my end is that we have in three different work settings. The time management is part of the challenges in reality. I think that's it.
I just like to add the One Health. It has been spearheaded by the Office of the Health Laboratories, where Net and Richard are connected. We have had several meetings, and it's a first for our country, wherein the Department of Health and that of the Department of Agriculture, the um, Bureau of Animal Health have sat down and been in a technical working group. And the quality system, just like what Richard has said, it is not specific for just one industry. It's for everybody. Like when we present it, there is no specificity as this can only be done in this aspect, but it's more of a um, um, it's for everyone.
Thank you, Dr. Jennifer. Thank you, Team Philippines, for your answers. Thank you, Rita, for those insightful questions. I'm gonna call on Damari for her comments now.
Sure, thanks, Uzma, and thanks, team, and thanks, Rita. Very good questions, which has made my job slightly easier. I wanted to say congratulations on the use of the picture of the hello, because I think of QMS when I when I look at that dessert. So really excellent adaptation of a photo to a concept. And congratulations on the delivery of the presentation. Good pace, very clear, and well explained. Well explained content of slides, etc. So that was a good job. One question I had listening to some of the feedback from the first group from Cambodia was, as you were going through the experience of the challenges of time management, reducing the content, did you also happen to think about, well, who would make good trainers to deliver? Could you think about how you would identify your trainers, mentors for QMS specifically? Did you get any thoughts as you went through the experience of doing this within your context? And I'd be happy to learn from your experience on that. Thank you.
I think I'll give first the floor to Net, since they are the Office of the Health Laboratories.
Actually, when it comes to QMS, the Office for Health Laboratories are providing this training to the different hospitals here in the country, in the clinical laboratories. So most often the trainer that we have in our mind is one is from the from the expert from the national reference laboratories. We have 6 national reference laboratories. So they will be one of the trainer. And of course, the Office for Health Laboratories. Thank you.
Damari, do you have any further comments?
No, nothing. Thank you. Thank you, Osma.
Thank you. And just like the last session, we have about, excluding the 3 of you and some of us, we have over 25 participants who are in this session. Do you have any questions specific to the Team Philippines? Okay. I just want to come back with, I think Rita and Damari covered most of the ground. Excellent presentation, very clear and very deliberate. Great example, because the example is outside the realm of the laboratory. And sometimes that is extremely, it engages the audience immediately because you're talking about lab and you suddenly go to food, and it's a great example. Then you also used an analogy for quality to a restaurant, which is again food, but it's again a great example to engage people in because people identify with things. Today, the 2 presentations that happened, I have just a general comment regarding that. And the comment is biosecurity, biosafety, and QMS are areas that all laboratory individuals from the 3 sectors understand quite well. So the technical piece of the emphasis is important, but remember, this is a leadership program. It's a leadership training program. So as facilitators and trainers, and even as mentors, if you have a dual role, please try to think about how, as a lab leader or a manager, they would be challenged on it. So they might know the technical piece of it. And when you said you had trouble selecting slides, you might not need to talk about all the technical piece in that detail. Ask them to go through materials and you could have a quiz or those pre-test questions. But try to emphasize the leadership aspect of how you're going to create a culture of biosafety security, how you're going to have a quality team that works together as a team, because those might be some of the leadership roles that might come in. Just giving some examples. When you discuss amongst yourselves, you can find hundreds of ways to do it. The other thing I want to emphasize is, and I appreciate that with both the teams, again, is the idea of the program is to bring sectors together. And that starts at every level, not just participants, as facilitators. Just like you identified it as a challenge, this is a great opportunity to come together at a safe time as you're preparing leaders, but also getting to know each other. So we really appreciate and commend your tackling the challenge and trying to find time on side meetings and other events to work on your program. But imagine if you had to do that for all the competencies, how are you going to do it? And I have a comment which my colleague Virginie put in the chat. Virginie, if you're able to speak, I'm going to leave that to you. Otherwise, just let me know if I can just go through that. She's writing a message in the chat, so I'll just do one more. In all of those things, it's going to depend on your country context. So how you have adapted it is going to be based on how much capacity building has already happened on some of those areas. And that might be through chatting with your participants in a cohort or understanding and reading documentation and regulations. So Virginie had a couple of comments and I want to share those with you. All of you now have access to the learning package contents. And if you see, in addition to the PowerPoint presentation and the facilitator guide, there's an e-learning version of those slides as well. And as you go through pre-planning and planning of your programs, that might be a good thing, a starting point to discuss which part of the modules or which modules you want to emphasize to be delivered through e-learning remotely to some of your participants. And maybe could be refreshed when your participants come for a face-to-face session. So I just want you to keep that at the back of your mind, that set of slides is, again, available to you. And it's a great resource to use if you think that there are not enough resources for people to be available for a long time, or people don't have time. So that can also help you in choosing and prioritizing content that you want to deliver face-to-face. And I just, and Virginie put a great suggestion, things like whiteboard, things like Mentimeter that you mentioned, they're great resources to use because this disengages the audience from just looking at slides. Because we are on time, I just want to hand over to Chintana and the organizational team for any closing comments and for introducing you to the Google form, which requires your feedback on 3 important issues. One, as a mentor, how can you best support your mentee in understanding the module's content? So put yourself in the place of a mentor. You might be a mentor and facilitator or one. The second one, you'll get these questions. Based on your learning, what are the key skills that an instructor might have? And I linked that to what Damari said, how will you choose your facilitators versus who will you choose as a mentor? And then if you had to facilitate a module for future GLLP instructors at a national TOT, what key messages would you emphasize? So imagine what you have done today, and you're going to be a master trainer at your country level. So go wild with your imagination. Please provide frank feedback. And I hand over now to Chintana and the team for the closing remarks. Unless there are any comments from the audience or the teams. I apologize. I should have said that first.
Thank you very much, Dr. Usman. So can I have my video turned on, my team? Yeah, I want to see everyone. So thanks a lot. Thanks a lot. So I, from our attending today, I think 45 minutes seem to be relaxed to the group, relaxed to the moderator and have ample time to pose question and discussion, something like that. So we will consult with the organizing team, GLLP Consortium, whether on the 19th, are we going to go for the 2 countries, and then we have the next round from the other country. But to be confirmed, to be confirmed. But our next date is going to be 19, same time, 19, same time. Let me, in addition to Dr. Usma presenting, if I will have my slide on. So the question that Dr. Usma highlighted will be sent again to those presenters today, like we did with the first group, right? Just to ensure that you respond. Slideshow, please. Yeah, slideshow. So we'll be sending this QR code to the group of Cambodia and Philippines today. Right, and then on the 19th, what I have information from coordinator Tanyapon is that Indonesia confirmed biosafety, right? Malaysia also confirmed equipment and consumables. That is Malaysia, very interesting topic as well. We still need to also, we wait for the Thailand team to confirm. I think Thailand team, they try to, get more experience and learning from the group first, and then they will decide. And hopefully by this week, they will send us the topic, right? So again, we will see each other at the same time on the 19th. Either it's going to be 2 groups or 3 groups. I will confirm back to you. Let me consult availability of the colleague who will be acting as a moderator or facilitator. Dr. Usama, you have anything to advise? So please.
No, nothing to advise. I just wanted to say this QR code is for all participants. Can you just clarify, or it's only for the countries that participated?
Country participated, yeah. No, it's for today's group because we already sent for the first group already. And everyone in that group need to do the questionnaire, right? Not only presenter, not only Dr. Jennifer or Rutana. No, we need to do everyone, right? Everyone. And the secretary team will compile the comment and share with the organizing committee, right? So with that, I think today we learn a lot. We also go to the real experience of, being a mentor, being a trainer, and utilize the menu that already provided by the GLLP consortium. But having that menu, you need to add more, chili, you need to add more sugar based on your taste and based on your context. That is the key messages for today. Not just using that menu because that menu somehow is too plain, not the spicy as your level, right? So adaptation is the key for today that we learn. With that, I really appreciate, the facilitator who lead the discussion today. Forgive me because I understood that Dr. Usma was with us during the workshop, but I just realized now that she was not part of our May workshop. Let me again emphasize that Dr. Usma is the right person because to comment on this course because she's part of the team when they develop this course. So she really she are the one who sitting in the team. So she knows the best if we're talking about the cost. So from her facilitation today, you also agree with me. But for Damri, I don't need to introduce because everyone knows Damri already. She's part of our team in the May meeting as well. So I'd like to congratulate two teams today. So wonderful job. And today we learned a lot and see all of you again on the 19th of August. So, and let me remind that for those who want to send the presentation, Tanya said 14 might be a good day for you to submit the PowerPoint. Once we receive your PowerPoint, it's very good exercise as well that our resource person have chance to look at your PowerPoint first, and if they have additional comment, then they can go back to you. So I think that also very good practice as well for phase number 3. So with that, I'd like to say thank you, goodbye, and ขอบคุณนะคะ good night to all of you, good day to colleague from the European, so see you on the 19th. Thank you very much. ขอบคุณนะคะ สวัสดีค่ะ สวัสดีค่ะ สวัสดีค่ะ
Thank
Thank
you.
you.
Thank you.
Bye bye.
Thank you. Goodbye.
Bye bye, Ma'am Net. Bye bye.
Thank you.
Bye bye. Thank you.